Hello everyone, I am Sneha, lecturer, Department of Physician Assistant, SNS College of Allied Health Science. Today we are going to see about anxiolytic agents. Anxiolytic agents also called as anti-anxiety medications. It is the pharmacological agents designed to reduce anxiety and also its associated symptoms. These medications will work by modulating various neurotransmitters in the brain. Neurotransmitters are chemical messengers which transmit signal from the nervous system to the entire body. By altering these neurotransmitters, the anti-anxiety drugs will work. We will see one by one. The major neurotransmitters which will be altered by anti-anxiety medications are gamma-aminobutyric acid, serotonin, dopamine and norepinephrine. Gamma-aminobutyric acid also called as GABA. It mainly helps to calm the brain and also reduce the activity in the brain. Next one is serotonin. It is another neurotransmitter which regulates our mood and also helps for emotional stability. Dopamine, it will work in fear reward system and also maintain the brain functions. Norepinephrine, it is activate the brain regions and it is helpful in stress responses. By altering these neurotransmitters, the anti-anxiety medications will reduce the patient anxiety and improve its symptoms. Classification. The first one is benzodiazepines. Benzodiazepines will increase the gamma-aminobutyric acid to calm the brain. Examples: diazepam, Lorazepam and Alprazolam. Selective serotonin reuptake inhibitors. Example: sertraline. These medications will work by increasing the serotonin. The third one is non-benzodiazepines. Example: Buspirone, Pregabalin. Fourth one is beta blockers. It will block the adrenaline to reduce the alertness. Example: propranolol. The fifth one is antihistamine. It will block the histamine. Example: hydrozazine. The last one is barbiturates. Example: amobarbital. Route of anxiolytic agents are oral, intravenous, intramuscular and sublingual. Based on the patient condition, we will select the route. Dosage: Alprazolam for adults 4 mg per day, Lorazepam adults 2 to 6 mg per day, diazepam 5 to 10 mg 2 to 4 times daily, Buspirone 15 to 30 mg per day, Pregabalin 150 to 600 mg per day. Mechanism of action: benzodiazepine enhances the GABA activity. It will reduce the brain activity and also provide calmness by increasing the inhibitory neurotransmission. The non-benzodiazepine act on various neurotransmitters, serotonin, dopamine and also GABA. By altering these neurotransmitters, it will inactive the brain. Histamine receptor blockage: it will block the histamine. Histamine is a neurotransmitter which helpful to provide the alertness. By blocking the histamine, it will calm the brain. Selective serotonin reuptake inhibition: inhibiting the serotonin transporter and also increasing the level of serotonin in the body, which will provide the emotional stability and also mood regulation. By blocking the beta adrenergic receptors, beta blockers will work by reducing the physiological symptoms of anxiety. Pharmacodynamics: the four major effects are produced by these drugs. First one is sedation, which induces the sleep. The next one is angiolysis, which reducing the anxiety. Third one is muscle relaxation. Fourth one is anticonvulsive activity. By altering the brain signals, it will reduce the activity of the brain. Pharmacokinetics: absorption variable depending on the route, distribution wide distribution including the brain tissue. Metabolism: the metabolism will occurs in the liver, elimination will occurs in the kidney. Indications: anxiolytic agents is provided to reduce the anxiety. It is recommended for anxiety disorders and also insomnia because it will induce the sleep. Third one is seizures. By reducing the brain abnormal activity, it will prevent the convulsions and also it is the management for the seizures. Muscle spasms: the anti-anxiety medications will relax the muscles, so it will help for muscle spasm. And also it will helpful for the alcohol withdrawal symptoms. It will reduce the anxiety for the alcohol withdrawal patients. Contraindications: we should not give anxiolytic agents to asthmatic patients because these particular drugs will do bronchoconstrictions. it will lead to respiratory depression. The next one is bradycardia. Beta blockers will block the beta adrenergic receptors. These receptors mainly responsible for regulating heart rate. By blocking these receptors, it will lead to bradycardia. Bradycardia means slowness of heart rate. Next one is hypotension. The inactivity and also calmness of the brain reduce the signals throughout the body. So less brain alertness will lead to vasodilation. So it will lead to low blood pressure. For pregnancy and lactation patient, we should not give anti-anxiety drugs because it will affect the fetus. For bipolar disorder, we should not advise anti-anxiety medications because it will lead to induce mania. So it will lead to further complications. For severe hepatic and renal impairment patients, we should not give anti-anxiety medications because it will affect the both liver and the kidney. Adverse effects, sedation, prolonged sedation will occur, and also drowsiness, confusion, memory impairment. These are all the adverse effects because we are providing anti-anxiety medication to reduce the brain abnormal electrical activity and also brain activity. So it will lead to memory impairment, confusion and drowsiness because of the brain altering neurotransmitters. Fatigue also occurs. Dependence, respiratory depression will occur because the brain will reduce the signals to the respiratory system, so it will lead to respiratory depression. And also reduce electrical brain signals to blood vessels, so it will lead to hypotension. And also by using beta blockers, it will create bradycardia in patients, and also blurred vision because the ciliary muscles will hold the lens to focus the objects, reducing brain activity and also reducing signaling transmission. It will relax the ciliary muscles also. Then our lens can't able to focus the object, so it will lead to blurry vision. As a vision assistant role by giving anti-anxiety medications are, first we have to educate the patient and also attenders about the medication use, potential side effects and lifestyle modification. And the another major function is monitoring patients of signs of dependence and also withdrawal or adverse effects. We have to immediately respond for the adverse effects. Thank you.